right now we're going to talk about the chapter 9 of microbiology, that is about inhibiting the growth of pathogens in vivo using antimicrobial agents. So let's proceed to number 1. So number 1, we're going to identify the characteristics of an ideal antimicrobial agent. Meaning ideal, mainam, like what's the most ideal na antimicrobial agent that we should look for, okay? So, the ideal antimicrobial agent should kill or inhibit the growth of pathogens, meaning dapat pinipigilan ng antimicrobial agent ang pagdami ng pathogens, or this antimicrobial agent could kill the pathogens, okay? It could either kill or prevent the proliferation of pathogens. It should cause no damage to the host. Dapat hindi man-damage ang host ng bacteria or ng microbe, okay? Dapat yung ma-damage lang ay yung target na microbe o yung bacteria. It should cause no allergic reaction to the host. Dapat hindi magkaroon ng allergic reaction sa host, okay? So it should be stable when stored in solid or liquid form. Okay, that is self-explanatory. It should remain in specific tissues in the body long enough to be effective. Okay? Dapat makapag-stay siya sa tissue, sa tissues ng body ng matagal, okay? Lastly, it should kill the pathogens before they mutate and become resistant to it, okay? Because there are pathogens that become resistant to antimicrobial agents, okay? So, an ideal antimicrobial agent should kill the pathogens immediately before they mutate, okay? Nakakapag-mutate kasi ang mga pathogens na maging resistant sila sa drugs, okay? Number 2 is we're going to compare and contrast chemotherapeutic agents, antimicrobial agents, and antibiotics, okay, as to their intended purpose, okay? So first is chemotherapeutic agents. So we always hear the word chemotherapy, okay? It's a common word to us kasi we often hear about chemotherapy that is being done to the cancer patients, okay? But actually, chemotherapy or chemotherapeutic agents is the general term, okay? It's the general term of any chemical or drug that are used to treat diseases or certain conditions, okay? That is like the broad term, okay, of drugs or chemicals na ginagamit para i-treat ang kahit anong disease, okay? So, ang mga drugs na ginagamit to cure or treat any disease are called chemotherapeutic agents, okay? Next is antimicrobial agents. So, ang chemotherapeutic agents na ginagamit na para i-treat ang infectious diseases are called antimicrobial agent, okay? Thus, an antimicrobial agent is any chemical or drug used to treat an infectious disease either by inhibiting or by killing pathogens in vivo. What do we mean by this? Antimicrobial agents are drugs or chemicals na ginagamit para i-treat ang isang infectious disease through what? Through killing the pathogens or inhibiting its growth or proliferation, meaning pinipigilan ang pagdami or pinapatay ang pathogens, okay? These are what antimicrobial agents do, okay? Next is antibiotics. So antibiotics is a substance produced by a microorganism that is effective in killing or inhibiting the growth of other microorganisms. Okay, so antibiotics are simple. Um, uh, Antibiotics ay nanggagaling or pinuproduce ng microorganisms, and these antibiotics na pinuproduce ng microorganisms are also used in killing or inhibiting the growth of other microorganisms. Okay, so antibiotics are produced by certain molds and bacteria, usually those that live in soil. Okay. Next. So we have in number 3, we're going to state the 5 most common mechanisms of action of antimicrobial agents. Okay? So, an antimicrobial agent, dapat pinapatay niya o pinipigilan ang pagdami ng pathogens without damaging the host. Okay? Na hindi naapektuhan ang host or hindi nakakos ng harm sa host. Okay? It should kill or inhibit the growth of pathogens na while not harming the host. Okay? So, here are the 5 most common mechanisms of action of antimicrobial agents. First is inhibition of cell wall synthesis, meaning dapat ang antimicrobial agents, hindi dapat nila it should not let the pathogens build or make their own cell wall. Okay, it should prevent the pathogens or the bacteria na gumawa ng sarili nilang cell wall. Okay, it should inhibit the pathogens from making their own cell wall. Okay. Next is damage to cell membranes. Dapat na kapag na-destroy ng antimicrobial agents ang cell membranes ng pathogens. Okay. Next is inhibition of nucleic acid synthesis, either DNA or RNA synthesis, meaning pinipigilan ng antimicrobial agents na makapag-synthesize ang mga pathogens ng kanilang own genetic identity. Okay? Either DNA or RNA synthesis. Next is inhibition of protein synthesis. Pinipigilan na makapag-synthesize ng proteins, okay? Ang pathogens. Next is inhibition of enzyme activity. Okay? Number 4, we're going to state the difference between narrow spectrum and broad spectrum antimicrobial agents. Okay, so narrow spectrum antibiotics kill either gram-positive or gram-negative bacteria. Okay, like either it could kill either gram-positive or gram-negative bacteria. Okay, it could kill either of them. Kahit gram-positive or gram-negative bacteria, mapapatayan ng narrow spectrum na antibiotics. Okay? Next is the broad spectrum antibiotics. Broad spectrum antibiotics kill both gram-positives and gram-negatives. Okay? Napapatay nila ang dalawa. Napapatay ng broad spectrum antibiotics ang both gram-positive and gram-negative na bacteria. Next is identify the 4 most common mechanisms by which bacteria become resistant to antimicrobial agents. So, here are the mechanisms na ginagawa ng bacteria na nagiging resistant sila to antimicrobial agents, meaning hindi na sila natatablan ng antimicrobial agents. Okay, so first is a chromosomal mutation that causes a change in the structure of a drug binding site. Meaning, nagkakaroon ng mutation ang bacteria na nagkakaroon ng pagbabago sa structure of a drug binding site. Sa drug binding site, nagkakaroon ng mutation, okay? Nag-iiba ang kanyang structure. So, in effect, the drug cannot bind to the bacterial cell kasi may mutation na nangyari sa drug binding site sa bacteria, okay? Next is a chromosomal mutation that causes a change in cell membrane permeability. Okay? Kumbaga, ang permeability, di ba, that's when certain substances could get inside or go out of the cell membrane, right? That's the permeability. So, in effect, the drug cannot pass through the cell membrane. Di na sila makakadaan sa cell membrane. The drug cannot pass through the cell membrane and thus cannot enter the cell. So, hindi na talaga sila makakapasok kasi nagkaroon ng mutation sa cell membrane permeability ng bacteria. Next is acquisition by conjugation, transduction, or transformation of a gene that enables the bacterium to produce an enzyme that destroys or inactivates the drug. Okay? So, nagkakaroon ng pagbabago sa gene ng bacteria, okay, na nagpuproduce sila ng enzyme na nagde-destroy or ginagawang hindi mabisa ang drug, okay? So, in effect, the drug is destroyed or inactivated by the enzyme, okay? Sa pag-produce ng bacteria ng isang enzyme na nakakapag-destroy or nakakapag-inactivate ng drug, magiging ineffective na talaga ang drug or it could be destroyed by the bacteria or enzyme na produce ng bacteria. Next is acquisition by conjugation, transduction, or transformation of a gene that enables the bacterium to produce an MDR pump. Okay? So, in result, the drug is pumped out of the cell before it can damage or kill the cell. Okay? Nakakapag-produce na naman through this, nakakapag-produce ang bacteria ng bacterium ng MDR pump, okay? So, in result, yung drug, mapapump out lang siya of the bacteria. Okay? Next is we're going to state what the initials MRSA, MRSE, CRE, VRE, and MDRO stand for. Okay? So, MRSA stands for methicillin-resistant Staphylococcus aureus. Okay? MRSA, methicillin-resistant Staphylococcus aureus. Okay? So, MRSE stands for methicillin-resistant Staphylococcus epidermis. MRSE, methicillin-resistant Staphylococcus epidermidis. CRE stands for carbapenem-resistant Enterobacteriaceae. CRE, again, stands for carbapenem-resistant Enterobacteriaceae. Okay. Next is VRE. VRE stands for vancomycin-resistant Enterococci. Okay, or cocci. Lastly, MDRO stands for multi-drug-resistant organisms. Okay?
May pwede na ka nun?
Next is we're going to define the terms B-lactam ring and B-lactam antibiotics and B-lactamase. So, B-lactam ring is a 4-membered lactam. Okay? alactam is a cyclic amide, and beta lactams are named so because the nitrogen atom is attached to the B carbon atom relative to the carbonyl. The simplest B lactam possible is 2-azetidinone. Okay? So B lactam antibiotics are antibiotics that contain a beta lactam ring in their molecular structure. So most B lactam antibiotics work in inhibiting the cell wall biosynthesis in the bacterial organism and are the most widely used group of antibiotics. Okay. Next, beta lactamases or B lactamases are a family of enzymes involved in bacterial resistance to beta lactam antibiotics. They act by breaking the beta lactam ring that allows penicillin-like antibiotics to work. Okay. Number 8, we're going to name the major groups of bacterial enzymes that destroy the B lactam ring. Okay. So, penicillinases and cephalosporinases are examples of B lactamases. These B lactamases, they destroy the B lactam ring in penicillins and cephalosporins, respectively. Okay? Some bacteria produce enzymes that destroy the B lactam ring. These enzymes are known as B lactamases. So, ang bacteria na nagpo-produce ng enzymes na nagde-destroy ng B lactam ring, they are called the B lactamases. Okay, so these are enzymes that destroy the B lactam ring. So when the B lactam ring is destroyed, the antibiotic no longer works. Pag na-destroy ang B lactam ring, hindi nagagana ang antibiotic. Okay? Thus, an organism that produces a B lactamase is resistant to antibiotics containing the B lactam ring. Okay? So, the two types of B lactamases are the penicillinases and cephalosporinases. Okay? Number 9. We're going to state the 6 actions that clinicians and or patients can take to help in the war against drug resistance. Okay? So first is education is crucial. Okay? Education of healthcare professionals and in turn of education of parents. Okay? So education really matters, be it with the patient or to the clinicians, the healthcare professionals. Okay, they should be educated. They should know about everything about this. Okay, so education is key in fighting, in winning the war against drug resistance. Okay. Second is patients should never pressure clinicians to prescribe antimicrobial agents. Okay. Parents must stop demanding antibiotics every time they have a sick child. Okay, the majority of sore throats and many respiratory infections are caused by viruses, and viruses are unaffected by antibiotics. Because viruses are not killed by antibiotics, patients and parents should not expect antibiotics when they or their child have viral infections. Okay. Instead of demanding antibiotics from clinicians, they should be asking why one is being prescribed. Okay? Because some diseases talaga are not affected or cannot be cured by antibiotics. I mean, antimicrobial agents. It is important that clinicians do not allow themselves to be pressured by the patients. Okay, they should prescribe antibiotics only when warranted. Example, when there is a demonstrated need for them. Okay, Whenever possible, clinicians should collect a specimen for culture and have the clinical microbiology laboratory perform susceptibility testing to determine which antimicrobial agents are likely to be effective. Okay, so it is important for clinicians, physicians, to not be pressured. Okay, to not pressure themselves. They should um, um, they should just prescribe antibiotics only when there is a blunt need. Okay, may need talaga. Like kung nakikita talaga may need. Okay, because they should follow certain processes. Okay, before prescribing certain antibiotics. Okay, so next is clinicians should prescribe an inexpensive narrow spectrum drug whenever the laboratory results demonstrate that such a drug effectively kills the pathogens. Okay? Dapat mag-prescribe ang clinicians ng like cheaper or inexpensive na mga narrow spectrum drugs. So narrow spectrum drug are those that kill either gram positive or gram negative na bacteria. Okay? Patients must take their antibiotics in the exact manner in which they are prescribed. Healthcare professionals should emphasize this to patients and do a better job explaining exactly how medications should be taken. Okay? So meaning, these antibiotics, they should be taken in in the exact manner that it should be. Okay? Dapat sundin talaga kung paano siya iti-take. Okay? And as well as with the physicians, they should explain it well to the patient. Okay? Next is, it is critical that clinicians prescribe the appropriate amount of antibiotic necessary to cure the infection. Okay? Okay? Then, unless instructed otherwise, patients must take all their pills, even after they are feeling better. Next is, patients should always destroy any excess medications and should never keep antibiotics in their medicine cabinet. Okay? Antimicrobial agents, including antibiotics, should be taken only when prescribed and only under a clinician's supervision. Okay? Number 10 is, we're going to explain the empiric therapy. Okay? So empiric therapy is when the physician initiates a therapy before laboratory results are available. Okay? This is like the educated guess of the physician or the clinician. In an effort to save the life of a patient, it is sometimes necessary for the clinician to guess, okay? To guess the most likely pathogen and the drug most likely to be effective, okay? With their experience and education in this kind of cases, it is also important for physicians to take a guess by observing the patient, by evaluating the patient, okay? Before the laboratory result comes out. Okay? So next is, we're going to list factors that a clinician would take into consideration before prescribing an antimicrobial agent for a particular patient. Okay? Before writing a prescription for a certain antimicrobial agent, several factors must be taken into consideration. So some of these are in the following list. First is, if the laboratory has reported the identity of the pathogen, the clinician can refer to a pocket chart that is available in most hospitals. This pocket chart, which is technically known as an antibiogram, is published by the Clinical Microbiology Laboratory. It usually contains antimicrobial susceptibility test data that have been accumulated during the past year. Okay, this pocket chart provides an important information regarding drugs to which various bacterial pathogens were susceptible and resistant. Okay, so this is like the notes na dala-dala dapat ng physicians, okay, when doing an uh, empirical empiric therapy. Okay, next is the patient allergic to any microbial agents? Okay, it should not, because it should not be the physician or the clinician should not, of course, prescribe the drug that to which the patient is allergic. Okay, the physician should ask this: what is the age of the patient? Okay, certain drugs are contraindicated in very young or very old patients. Okay, so knowing the age spectrum of the patient is important in prescribing antimicrobial agents as well. So, is the patient pregnant? Certain drugs are known to be or suspected to be teratogenic. Example, they cause birth defects. Okay, so kung pregnant ang patient, the physician or the clinician should be cautious. Okay, in prescribing certain drugs. Okay, because it might cause certain problems to the pregnancy of the patient or the birth when they give birth. Okay, next is the patient an inpatient or outpatient? Certain drugs can be administered only intravenously and therefore cannot be prescribed for outpatients. Okay, meaning mayroong mga injectables lang na mga drugs. Okay, so hindi pwede na ang mag-administer ay the outpatient. O hindi pwedeng ma-administer ng outpatients, okay, without the assistance of healthcare professionals. Next is, if the patient is an inpatient, the clinician must prescribe a drug that is available in the hospital pharmacy. Okay, dapat available lang sa hospital pharmacy ang drugs na prescribe pag ang patient is an inpatient, okay, or inpatient meaning admitted to the hospital. Okay, next is we're going to state 3 undesirable effects of antimicrobial agents. So we have here 3 undesirable effects of antimicrobial agents. So first is, whenever an antimicrobial agent is administered to a patient, any organisms within that patient that are susceptible to the agent will die, but the resistant ones will survive. Okay, this is referred to as selecting for resistant organisms. Okay, the resistant organisms then multiply, become dominant, and can be transmitted to other people. To prevent the overgrowth of resistant organisms, sometimes several drugs, each with a different mode of action, are administered simultaneously. Okay. Second is, the patient may become allergic to the agent. Okay. For example, penicillin G in low doses often sensitizes those who are prone to allergies. Okay. Next is, many antimicrobial agents are toxic to humans. Okay, and some are toxic so that they are administered only for serious diseases for which no other agents are available. Okay, may mga antimicrobial agents na toxic sa humans. Okay, next is number 13. We're going to explain what is meant by superinfection. Okay? So, prolonged antibiotic use can lead to population explosions of microorganisms that are resistant to antibiotics being used. Okay? So this overgrowth is known as super infection or super infections. Okay? Pag ang prolonged or pag matagal na gumagamit uh, ang patient ng antibiotic, and there it could lead to population explosion ng microorganisms na resistant sa antibiotic na ginagamit. Okay? Meaning dadami ang microorganisms na resistant sa antibiotic na ginagamit. Okay? With prolonged use, broad-spectrum antibiotics may destroy the indigenous microbiota of the mouth, intestine, and vagina. The person no longer has the protection of the indigenous microbiota and thus becomes much more susceptible to infections caused by opportunists or secondary invaders. The resultant overgrowth by such organisms is referred to as superinfection. So, in simpler terms, pag prolonged na ang paggamit ng certain antibiotics or a certain antibiotic, nagde-develop, naglilid ito na makapag-develop ng more microorganisms na resistant sa antibiotic na yan. Okay? So, pag dumami na yan, it is called superinfection. Okay? Magkakaroon ng population explosion. So number 14, last item for chapter 9, we're going to explain the difference between synergism and antagonism with regard to antimicrobial agents. Okay? So when the use of two antimicrobial agents to treat an infectious disease produces a degree of pathogen killing that is far greater than that achieved by either drug alone, the phenomenon is known as synergism. Okay? In simpler terms, pag dalawang antimicrobial agents ay ginamit at the same time to treat a certain infectious disease, and nakapag na-treat nito ng dalawang antimicrobial agents na to ng faster or better, for better treatment or better elimination or better killing of a certain pathogen, meaning that synergism of two microbial agents is better, like yung treatment, yung pag-treat ng dalawang antimicrobial agents is better than using either of the drugs alone. That is called synergism. Okay? Next is antagonism. Okay? When two drugs are prescribed, perhaps by two different clinicians who are treating the patient's infections that actually work against each other, this is known as antagonism. Okay? Pag may dalawang drugs na prescribed and these drugs work against each other, that is known as antagonism. Okay? The extent of pathogen killing is less than that achieved by either drug alone. Okay? So, kahit may yung synergy ng dalawang drugs na to, ay hindi naman lang natumbasan ang effect ng drug lang, ng isang drug alone lang. Okay? So, that is called antagonism. Hindi sila nag-work together. Okay? So, that is all for chapter 9, and we're going to move to the next chapter in the next video.